and that is inflammation of the temporomandibular joint itself causes all the symptoms. And if you can figure out a way to make the inflammation go away within the temporomandibular joint, the symptoms go away. And we will have a lot to say about that in the future. That is not the topic for today's discussion, but I want you to keep that in mind as we go through any of the subtopics. And sooner or later, we will, reverse course and circle back on all of these things time and time again, and cover all this material thoroughly. But today I want to talk about how common TMD is. As I got into it, I found it much, much more common than I thought. And I had treated it in training for sure. And then when I came out of training, actually, it was a large part of my practice. And as I've stated before, I believe, over a period of 25 years, I did over 2,000 different various kinds of temporomandibular joint surgery. But with all that experience, patients would come to me, I would do what I thought best, the textbook says, but I had no idea how common it was and how impinging it was on so many people. So first of all, the commonality can be defined in kind of two ways. One of them is prevalence and the other is incidence. And I want to go over the definition. Remember, if you want to argue with me, define your terms. So this is a good time to define the difference between prevalence and incidence. And then we'll talk about those two quantities, those two statistics as they apply to temporomandibular joint problems, but very important in really understanding this whole problem once you get into it and you actually start dealing with patients. I'm setting you up to deal with patients, what I'm trying to do. Not just for the heck of it, giving you knowledge so that you can say, well, yeah, I know about TMD. I'm setting you up so that you can actually fix the problem. And we'll talk at great length about how you make inflammation in the joint go away and the different methods, but the method that we developed over many years, again,